Hello, good morning, everyone. Please come up with your queries. Good morning, everyone. Please come up with your queries. Question number 46 and 49, right? Question number. Good morning, everyone. Please come up with your queries. Question number 49 is contraindication of lab sterilization, right? This is a question number 49. Okay, question number 49 is contraindication of lab sterilization. So, as in laparoscopic sterilization, we have to give general anesthesia, short GA or short general anesthesia. So, very high morbid patient cannot be given. So, question number 49 is all are contraindication of laparoscopic sterilization except. So, one main contraindication of laparoscopic sterilization is that it cannot be given up till 6 weeks postpartum. Up till this CI is contraindication, students. Okay, up till 6 weeks postpartum cannot be done. Laparoscopic sterilization cannot be done, and it cannot be done in morbid conditions because it involves giving the patient general anesthesia, short general anesthesia. Same is the question number 54, contraindication of laparoscopic sterilization. I hope it's clear to you, Rachna and Banazir. You both were having this confusion of question number 49 and 54 are linked with this. Okay. Next question is 46. Safe period in the rhythm method is, so what is basically the safe period? Safe period is natural method of contraception. Safe period, rhythm method, billing method. This is question number 46. Okay, safe period or rhythm method, billing method or behavioral method or natural method, they are one and the same. As you know that ovum gets ready around 14th day. Okay, ovum gets ready around 14th day, right? And sperms lives there in the female. Sperm life is 2 to 3 day. Okay, 2 to 3 day, but it is not always possible that a female has a regular cycle of 28, right? So just to explain it nicely, what the instructions are to say not to do intercourse in between 14 days. In between 14 days they are unsafe, and the first and the last 7 days are safe. Is it clear to you? 46 question. Rachna, is it clear to you? Okay, let's take the next question. 45. Dr. Sumit, 45 is already been explained that after the delivery, as this is the explanation of 45, that just after the delivery we cannot do laparoscopic sterilization because it needs short general anesthesia. So just after the delivery the lady is in a hypercoagulable state, so we cannot give short general anesthesia. Okay, question number 45, 49 and 54 are same. Okay, let's take Dr. Sumit next question. It is 30 number question is P3L3 diabetic woman with malignant retinopathy. See, as this lady has three children. This is question number 30. As this lady has three children. The lady is para 3, live 3. And in the lady with diabetes mellitus with retinopathy, so it's basically a case of vasculopathy. So here we cannot give combined oral contraceptive pills and we cannot give copper T, right? So in this case we prefer permanent sterilization. Okay, permanent sterilization, because temporary methods cannot be given in the patient with diabetes with vasculopathy. Okay, next is after 30 it is 24. 24 number question is emergency contraception includes all except. Now this is very confusing question. Emergency contraception, you all know that we can use copper T as emergency contraception. We can use copper T as emergency contraception, but we cannot use levonorgestrel IUCD. Can you tell me why? Because in the levonorgestrel, what is the daily progesterone which is released? It is 20 microgram, right? We have this one question that 20 microgram progesterone is released by levonorgestrel IUCD. And what is the dose of levonorgestrel which will act as emergency contraception? It is 1.5 mg. Isn't it? We studied that. So how this levonorgestrel IUCD will do the function of emergency contraception? Please learn it. 2-3 times it has come in post-grad exam. Please understand this, that levonorgestrel IUCD or Mirena, they cannot be used as emergency contraception. Okay, next question is 13. Carcinoma cervix is prevented by. So it is simple. Carcinoma cervix is caused by HPV, right? Carcinoma cervix is caused by HPV and it is a virus, right? So the transmission of this virus from male to female during the intercourse causes the CA cervix. So if the barrier is there in between, this virus will not go to female. Okay, is it clear? Let me take the fifth question. Fifth question is, which of the following used as emergency contraception can be used as maintain ongoing contraceptive? Okay, so this was 13th number question. And the fifth number question is, which emergency contraception? What is this question? What do you understand by this question? That you have used some method of emergency contraception and the patient can also now use it in the near future for simple contraception. So that method is copper T. Copper T once inserted will act as emergency contraception, plus copper T will also be, patient can also use as mode of contraception in the future. Okay, second number question is false about rhythm method is. So here we were discussing the rhythm method. So first option is itself wrong. Abstinence is needed only in. So here we are doing question number 2. Okay, abstinence is needed only for few days in the month. You can see here we are telling the couple that only first 7 days and last 7 days are safe. We are telling the couple that first 7 days and last 7 days are safe. In between these 14 days, you don't have to do intercourse. So almost about half the month you are telling the patient to have abstinence. Okay. Second option is safe period can be observed during temperature method and mucus method. Yes, if a patient is having a good IQ, then patient can see what is the safe period in which the temperature rises and in which the cervical mucus is having spin bucket effect. That period is unsafe, rest all is safe. Ectopic pregnancy is reported. Yes, ectopic pregnancy do occur. Associated with no cost. Yes, it is not associated with cost. No cost, कोई पैसा नहीं लगता है. ठीक है, let me take the next question. Question number 45. Good morning, Ajay Singh. Question number 45. Laparoscopic sterilization, it has been taken. Ajay, still if you are having the problem, I will take it. ISRA 35. All are mode of action of emergency contraception except. See, here I would like question number 35. All are mode of action of emergency contraception. So I want to tell you there are 3 methods of preventing pregnancy. Okay, preventing pregnancy. Okay. First, the 2 acts which are there is one is coitus and the another act is implantation. Okay. If a couple is using any method just before the coitus, then that method is known as contraception. If it is before the coitus here, if any method is used, then it is contraception. If any method is used after the coitus and before the implantation here, then that is known as emergency contraception. If after implantation it is used, then it is abortifacient or abortion. Okay, so interference in early pregnancy is done by abortifacient. Okay, interference in early pregnancy is done by abortifacient. I hope you get it. Mifepristone and misoprost are abortifacients. Is it clear, Isra? Next is Rachna and Isra are asking 24. Emergency contraception includes all except. This has been taken. Lavanya is asking, ma'am, few points about RU 486 and Nova T. Okay. RU 486 is the chemical name of mifepristone, which is basically anti-progesterone. Anti-progesterone. In contraception, its used is as emergency contraception. Emergency contraception. Let's see what is its uses in OBS. in the this we are discussing in gynae, right? What is its use in gynae? Gynae may, how we can use it? So it is used as emergency contraception. The dose which is used is 10 to 50 mg. Okay, and it can also be used in fibroid and endometriosis. Now, what is its use in obstetrics? It is used in abortion because it does cervical ripening, and it is used in induction of labor, again because it is a cervical ripening agent. It is also sometimes used in ectopic pregnancy to kill the fetus. Okay. Next, Lavanya, you was asking about Nova tea. What is Nova tea? Nova tea is a copper tea which contains silver, very small amount of silver. Okay, because copper tea is famous to cause pelvic infection. So a thought was given to introduce silver because silver is anti-infection. One more type of copper tea is multi-load. What is multi-load? Basically, multi-load the tea of the multi-load is like this. Okay, and copper is impregnated here. Okay, so this is this multi-load, this shape is to decrease expulsion. I hope it is clear. Lavanya is clear. Those who want to join the quiz at 12 p.m. can join. Okay, I'm starting the quiz. Okay, Lavanya, it's clear to you, Lavanya, now. Next, which you were asking was ISRA 35 is clear. Banazir, ma'am, IUCT and copper tea is same group. Okay, though we did it yesterday, let me tell you, IUCT, they are of 3 generation. First generation contains Lippy's loop, the old traditional one. Okay. Second generation contains copper tea, the tea one which has copper on it. The third generation contains hormonal copper tea, which is basically Merena. Is it clear to you? Banazir, is it clear to you? Isra is asking 41. Uriplistal dose. Uriplistal dose is 30 mg. Let me tell you the doses of all the emergency. It is question number 41. Let me tell you the doses of all the emergency contraception. These doses are quite frequently asked. This is a question of NEET PG. Dose of ulipristal. Okay. So first was levonorgestrel, the I pill or unwanted 72, or the unwanted 72, or after morning pill, morning after pill, or after morning pill, I don't know what it is. Levonorgestrel dose is 1.5 mg single dose. If you are giving 0.75 mg, then 2 doses. Okay, and the dose of mifepristone is 10 to 50 mg. The dose of ulipristal is 30 mg, and I think anything is left. High dose. And the UHP regimen. In the UHP regimen, if you are using 2 days contraception pill, then 4 in the morning and 4 after 12 hours. These are the doses. This all doses you have to learn, Isra. Okay, and this all doses are in the mg. Basically, emergency contraception has to act in emergency. We have only 6 days after for the implantation. Okay, so we give high doses so that pregnancy can be prevented at any cost. So these all doses are in the mg. Please don't get confused in the exam. These all doses are in the mg. Okay, next is ma'am, please explain on DMPA. Okay, what is DMPA? Before explaining Karishma on DMPA, I would like to explain about progesterone only contraception. Progesterone only contraception. Okay, few points about progesterone only contraception. Basically, progesterone only contraception contains only one hormone, progesterone. And what is the function of progesterone? This was asked in Nepal PG. Nepal PG was on 17 December. Just few days back it was asked. What is the action of progesterone on the endometrium? Please write down in the chat box. Please write down in the chat box what is the action of progesterone on the endometrium. This was the question of Nepal PG recently conducted. Action of progesterone on endometrium. We are giving progesterone from the day 1. Progesterone blocks the LH surge and thus inhibits ovulation. But what is the action on what is the action of progesterone on endometrium? You write down. Till then I will take Lavanya question. Lavanya is saying that UHP is 2 plus 2. Beta, UHP method, Lavanya, UHP method was introduced somewhat near 1980s. Okay, somewhat near that. At that time, the doses in the contraception pills were very high. Okay, the estrogen in the contraception pill was 50 microgram and the levonorgestrel in the pill was 250. These days, even in the Maladi, the one which is occurring, the one which is coming in the Maladi free of cost, it is having 30 microgram estrogen and 150. So as you're seeing, the doses as compared to 1980s have almost half down. So in the UHP regimen, we use 4 pills of 2 days. Modern pills, we use 4 in the morning and 4 in the afternoon. Is it clear to you, Lavanya? At that time, when UHP introduced, it was in 1980, it was 2 and 2. But now it is 4 and 4. Okay, if we take this method now. Okay, yes, we were here on this question of DMPA injection. The action of progesterone on endometrium is to stop the, yes, you are right, Lavanya, you are right, Isra, you are right, Sumit Yadav, you are right. It stops the endometrium to proliferate, okay, and it makes the endometrium secretory. So it stops the endometrium to proliferate. When we are giving this pill or this contraception from day 1, then it will not let the endometrium to proliferate. Naturally, this progesterone comes at day 14. But when we are giving it as a contraception, we are giving it from the day 1. So progesterone will not proliferate at all. If it will proliferate, only very thin it will proliferate. So all the progesterone contraception, they cause thinning of endometrium. That was the question in the Nepal PG. Thinning or thickening of endometrium. Okay. So it causes thinning of endometrium. Okay. So now because this thinning of endometrium is occurring, so it protects against endometrial cancer, and number 2, it prevents menorrhagia. Okay, whichever progesterone only pill we are using, it protects against endometrial cancer and it prevents menorrhagia. Now problem with this first of all, what was introduced was progesterone only pill. Okay, problem with this pill was, if this pill was missed for 1 hour, its contraception effect goes. Okay, its contraception effect goes. So this pill was not compliant to the females. Okay, so their sustained release formulation were made, which included, first formulation was injection deposit of medroxyprogesterone acetate. Okay, this injection is need not to be remembered. Slowly it works for 3 months. Okay, and it helps in 2 diseases. One is epilepsy and number 2 is sickle cell anemia. It helps in these 2 diseases. Its failure rate is 0.3%. 0.3%. Is it clear to you? Who has asked about the DMPA? Is it clear to you? Karishma, is it clear to you, DMPA? Sumit, Lavanya, is it clear to you? It is not 2 plus 2. It is not 2 plus 2. Karishma, is it clear to you? Please write down in the chat box. (47) Not true regarding non-scalpel vasectomy. Let me tell you about non-scalpel vasectomy. Non-scalpel vasectomy, it is same as conventional vasectomy, only the difference is that we are not using the blade here. What we are using a specialized instrument which tears the scrotal skin, but it is not laser, it is not blade. Okay, in non-scalpel vasectomy we are not using blade and we are not using laser. We are simply using a steel instrument. Okay, and it tears the scrotal skin without causing the sharp pain of the blade. That is a difference. It has come, this method has come from China, right? Otherwise it is one and the same. Karishma, so it should be avoided in endometriosis. Why, Karishma? I told you it causes thinning of the endometrium. So what is the treatment of endometriosis? What is the treatment of endometriosis? In the endometriosis, the problem is that the endometrium in the ectopic site is causing all the problem. The endometrium at ectopic site, when that undergoes all the changes, it causes problem. Okay, it causes adhesions. What it causes? It causes adhesions, it causes pain, right? Endometrium at ectopic sites, when it undergo the hormonal changes, it causes adhesions, pain. So what we do in endometriosis, we make the endometrium to not to proliferate, right? So doing that, we also allow the normal endometrium to not to proliferate. So injection DMPA is very good in endometrium. Karishma, a basic treatment of endometriosis is to stop the endometrium to proliferate. And when we at the ectopic site, okay, to stop the endometrium wherever it is, and when we are stopping the endometrium to proliferate at ectopic site, then we also stop the endometrium to proliferate at the uterus site also. So basically we don't want this adhesions. Are you thorough now? Okay. Isra is asking 47. Isra, 47 has been taken. Is it clear to you? 50 is not taken. Highest incidence of ectopic is seen with. Isra, 47 we have taken. 50 is not taken. Okay, let me take the 50. Highest incidence of ectopic is seen with. Highest incidence of ectopic, same as we have Mirena, we had a progesterone IUCD called progesterate, and it was banned in 2003 because it causes increased incidence of ectopic on failure. So it was banned. The reason behind banning this was increased incidence of ectopic. Is it clear? Okay, let me take 47 again. See, 47 question is about non-scalpel vasectomy. Okay, what we do in conventional vasectomy, which we were doing before the non-scalpel vasectomy, we were taking out the vas deferens and ligating it, right? That what we were doing, and we were cutting the scrotal skin with the blade. Then this non-scalpel vasectomy, it came from China, and in the China it was very popular. That we didn't use, the only difference was that we don't use blade. In non-scalpel vasectomy, we don't use blade. Scalpel is blade, right? So we don't use blade. Then how we cut the skin of scrotum? We cut it with a very pointed instrument, and in the non-scalpel vasectomy, we don't use laser to cut the scrotal skin. Okay, and we don't use the scrotal skin, and we don't use the blade, because we are not using. Yes, beta. Levo, Isra, you are asking, Melena is a progesterone IUCD. Yes, it is a progesterone IUCD. It contains levonorgestrel, and it is a progesterone IUCD. Okay, so we are not using blade, we are not using the laser, we are using a very small instrument, very sharp pointed instrument to cut the scrotal skin. And it was very beneficial and very famous among the patients, because the pain which is caused by blade was gone now. So patients were very compliant to this non-scalpel vasectomy. Is it clear, Isra? Any other problem? Any other problem? Can we close the session? Can we close the session? Yeah, Mirena is available. Mirena didn't cause uh, ectopic pregnancy. Mirena is available. How to contact you personally? Okay, it is at the rate Dr. Rana. This is my Telegram ID at the rate Dr. Rana. All of you are invited. Any problem with obs gynae, any motivational problem, all of you are invited. Should we close the session now if all the queries are clear? Please give a thumbs up if you want to close the session.